Bismillahirrahmanirrahim, and welcome back to this next video. And this is yet another video in the series of videos on the cystic fibrosis. Now, in the previous videos, I've told you what is cystic fibrosis and why cystic fibrosis is there. What are the genetic causes of the cystic fibrosis? Then I told you about the different inheritance pattern or different inheritance scenarios that you can see in case of the cystic fibrosis. And in this particular video, I want to focus on the symptoms of the cystic fibrosis. Now, when you talk about the symptoms of the cystic fibrosis, in my previous video, I've told you that there is a problem in a chloride ion channel in the body in case of the cystic fibrosis, and that particular chloride ion channel is known as the cystic fibrosis transmembrane conductance regulator. Now, what happens is that in the normal cystic fibrosis transmembrane conductance regulator, for short, that is known as the CFTR protein. So normally at position number 508, there is a phenylalanine amino acid, but when there is mutation, there is a deletion mutation, and because of that, at the phenylalanine at the position number 508, that is deleted, and thereby you are getting a protein of 1479 amino acids instead of the normal 1480 amino acids. And when that happens, that is actually going to disturb the distribution of the chloride ions in the interior and the exterior of the cell. Now, what happens is that when there is this mutation, the CFTR mutation, the concentration of the chloride ions in most of the cases that is trapped inside the cell, especially on the epithelial surfaces of the different organs. And when the chloride ion that is trapped inside the cell, the mucus that is present on the exterior of those epithelial cells that become thick instead of the thin, and that thick mucus is actually responsible for most of the symptoms that you see in the cystic fibrosis. So the symptoms of the cystic fibrosis, they can be respiratory in nature. And when you talk about the respiratory systems, there is persistent cough with productive thick mucus. And as I've told you, this thick mucus is because of the misdistribution of the chloride ions in the interior and the exterior of the cell. There is wheezing and the shortness of breath because of this thick mucus. And there is a frequent chest infection, and this frequent chest infection is most of the time because of the Pseudomonas aeruginosa bacteria, because this thick mucus is favoring the growth of the Pseudomonas aeruginosa in the lungs of the patients with the cystic fibrosis. There can be a sinusitis, and there can be nasal polyps in case of the cystic fibrosis. Now, these nasal polyps, they are actually soft, painless, non-cancerous growth lining the nose or the sinuses, and because of these growth, there can be the problem of the sinusitis, or there can be nasal polyps. There can also be reproductive problems in the patients of the cystic fibrosis, and 95% of the men and 20% of the female with the cystic fibrosis, they are infertile. So when you talk about the men, the problem is that there is congenital bilateral absence of the vas deferens, and when this vas deferens that is absent, this is actually the tube which is joining the testicle to the penis. So if there are sperms in the testicle, but if you do not have this vas deferens, this tube, so it will not be able to move the sperms from the testicle to the penis, and hence that particular man that will be infertile. So there can also be reproductive problems in case of the cystic fibrosis. There can be a lot of the digestive problems like the bowel disturbances. There can be weight loss, and there can be obstruction, there can be constipation, that all of because the chloride ion misdistribution is actually going to affect the digestive problem in a variety of the ways. There can also be osteoporosis, and there can also be arthritis in the case of the cystic fibrosis. And when you talk about this osteoporosis or the arthritis, actually there is problem with the digestion that make it hard to absorb the vitamin D. So when you take the food, you will not be able to absorb the vitamin D because of the problem with the CFTR protein. And if you are not able to absorb the vitamin D, that means there will be a low vitamin in that particular individual. And when there is low vitamin D intake, that can actually increase the risk of developing osteoporosis, because this vitamin D is actually helping the body to absorb calcium, which is very essential mineral for the healthy bone density. So these are some of the symptoms that you can see in the patients of the cystic fibrosis. It doesn't mean that all of the symptoms they will be present in one individual, but you can see different kind of the symptoms in different patients with the cystic fibrosis. So if you like the video, please subscribe to my channel, hit the like button and share it with your friends. In the next video, I'll be focusing on the diagnosis of the cystic fibrosis.